Teeth whitening. So what is teeth whitening really all about? The following report includes some fascinating information about teeth whitening info you can use. Tooth bleaching, also known as tooth whitening, is a common procedure in general dentistry but most especially in the field of cosmetic dentistry. Many people consider white teeth to be an attractive feature of a smile. A child's deciduous teeth are generally whiter than the adult teeth that follow. As a person ages, the adult teeth often increase in value, that is to say, they become darker. This darkening is due to changes in the mineral structure of the tooth, as the enamel becomes less porous. Teeth can also become stained by bacterial pigments, foodstuffs, and tobacco. As white teeth are subconsciously associated with youth, they have become desirable. This has been made more apparent with the spread of American culture worldwide, where an especially white smile is coined a Hollywood smile. The procedure to bleach teeth uses oxidizing agents such as hydrogen peroxide to lighten the shade of the tooth. The oxidizing agent penetrates the porosities in the rod-like crystal structure of enamel and oxidizes into prismatic stain deposits. Over a period of time, the dentine layer, lying underneath the enamel, is also bleached. There are two main methods of bleaching. The first involves applying a high concentration of oxidizing agent for a short period of time, which is the so-called office bleach. This produces quick results but risks chemical burns to the soft tissues. Therefore, most in-office bleaching procedures use a light-cured protective layer that is carefully painted on the gums and papilla, the tips of the gums between the teeth. The bleaching agent is either carbamide peroxide, which breaks down in the mouth to form hydrogen peroxide, or hydrogen peroxide itself. The bleaching gel typically contains up to 35% hydrogen peroxide equivalent. The alternative method involves using a thin mouthguard or strip to hold a low concentration of oxidizing agent next to the teeth for as long as several hours a day for a period of 5 to 14 days. This is known as take-home or over-the-counter bleaching. This is a slower process but has fewer risks to the soft tissues. The bleaching agent is typically less than 10% hydrogen peroxide equivalent. A typical course of bleaching can produce dramatic improvements in the cosmetic appearance of most stained teeth. However, some stains do not respond to bleaching. Tetracycline staining may require prolonged bleaching, as it takes longer for the bleach to reach the dentine layer. White spot decalcifications may also be highlighted and become more noticeable. Recently, efforts have been made to accelerate the bleaching process by the use of light. Studies have shown varying results as to the efficacy of light-activated bleaching. Side effects of tooth bleaching include chemical burns, if a high-concentration oxidizing agent contacts unprotected tissues, which may bleach or discolor mucous membranes, sensitive teeth, and overbleaching, known in the profession as fridge door teeth. Rebound, or teeth losing the bleached effect and darkening, is also an issue, with some studies showing the rebound effect over 30 days. A recent study by Kugel et al. Has shown that as much as 4 shades of lightness can be lost over 30 days with light-activated, office bleaching. Types of teeth whitening. Whiter teeth are a staple in the health and beauty industry. Never would you see a model or celebrity with yellow or stained teeth. Let's face it, whiter teeth bring confidence. There are several ways for the average person to obtain a whiter and brighter smile. Here are the most popular. Dentist whitening. We will start out at the priciest end of the spectrum with professional whitening in the dental office. Most dentists use a carbamide peroxide in the form of a gel and provide customized dental trays molded by plaster casts of your teeth. These trays reduce the risk of whitening lines due to the fact they are made just for you. In contrast, most at-home kits provide the same carbamide peroxide, just not the form-fitting tray. Dentists charge up to $600 for this treatment, mainly to cover time and office costs. At-home whitening gels for a much cheaper price. We are able to obtain whiter teeth in the comfort of our own home by using at-home kits. Most of these kits contain the same strength carbamide peroxide formula as your dentist, or possibly a more powerful formula. Another benefit of at-home whitening is the price. You're not paying a dentist or his employees, so you will find yourself paying hundreds less than you would at a dental office. Some quality kits can go as low as $39. The only real downside of an at-home kit is the quality of the dental tray, as it's typically a boil and bite mouthpiece. You may find these a little less comfortable than their dentistry counterpart. Whitening strips. The results from whitening strips are usually less than desired. Major brands and off-brands have been known to disappoint, showing a mild effect over the course of a month. The problem is that most pharmaceutical-backed companies are looking for a way to make a recurring profit from its consumers. Thus keeping a weaker product on the shelves keep you coming back until desired results are acquired. In some cases, this could be months or years. Whitening toothpaste seems to have little or no effectiveness. I myself recently tested a popular toothpaste brand, known for its supposed whitening power. I realized that at most, one line of paste could only contain a mild active ingredient and you would have to brush your teeth for an hour for any noticeable result over a period of a month. Whitening toothpaste seems to be a marketing ploy that sells more from us being so eager for improvement. In conclusion, the real contenders here are dental and at-home whitening kits. They will provide you with your desired results in the shortest amount of time. Saying that at-home whitening kits allow you to save hundreds of dollars and the peace and quiet of your own home, and no eerie dentist offices. Thank you for watching.